Hello, I'm Emery King, and I'd like to welcome you to Our Health. And our guest today is Dr. Clyde Yancy. It's a pleasure to have you with us, Dr. Yancy.
Thank you. I'm happy to be here,
Good.
Mr. King.
Thanks for being with us. As president of the AHA, can you share with us the goals and the mission of the organization in fighting heart disease and stroke in the African American community?
The American Heart Association is really a fantastic organization. It's a volunteer health organization that is 22 million people strong. It's in every state in the Union. Our mission is to build healthier lives free of heart disease and stroke. That is an updated iteration of earlier mission statements that said fighting heart disease and stroke. But now we're building healthier lives free of heart disease and stroke. Think about the transition. We've gone from being in battle, trying to find a way to make a difference for those that are impacted by heart disease and stroke, to making a pivot and saying now our mission is to build healthier lives that don't have this burden. That is precisely where the African American community needs to be. There is no question about this. The African American community is the most burdened community in the world due to heart disease and stroke. I mean that, in the world. The death rate due to heart disease and stroke in the African American community is the highest amongst any peoples on this planet.
Give us, that's a very strong statement, and I would imagine that the numbers and the data is alarming. Can you give us a sense of?
It is absolutely alarming. Compared to other populations in the world, the death rate in the African American community due to heart diseases and stroke is 6-fold higher. Let me put that in context. 6-fold means 600% higher. It means 6 times higher. So if somebody else's death rate is 2%, the African American death rate is 12%. It's that compelling. If you think about just this one most pervasive problem, which is high blood pressure, clearly 1 in 3 young African Americans in their late 20s and 30s are already impacted by high blood pressure. If you think about something like obesity, over 50% of African American women aren't just overweight, they are obese. When you think about diabetes, nearly 40% of the African American community is not only diabetic, but is at risk for the most deleterious, the most harmful, the bad stuff, consequences of diabetes. This is a big deal. And anybody in the African American community that dismisses these risks, that doesn't embrace this risk in their life view, in their lifestyle, you've missed the boat. I know there are a lot of compelling day-to-day struggles in the African American community, but this is the big one. If you want to sit down and say, would you, Emery King, or me, Clyde Yancy, be most likely to die? It's not due to AIDS. It's not due to homicide. It's not due to trauma. It's due to heart disease and stroke. That's our big risk.
And it starts at very young ages.
You know, the data are compelling. In African American children, get ready for this, at the age of 10, there's already evidence of stiffer blood vessels. Stiffer blood vessels leads to high blood pressure. The incidence of obesity is highest in African American youth and Hispanic youth. The incidence of smoking, my goodness, what are we doing? The incidence of smoking is highest in African American youth. It is a problem that has consequences that are almost incalculable.
This, what fuels this? Is it fueled mainly by stress? Is it fueled by mass media and the sort of glamorization of food? We always associate African Americans with, oh, soul food. You got to sit down for a big dinner of macaroni and cheese and that sort of thing. It's going to require a complete adjustment of our mindset as a people, isn't it?
So I like the last thing you said, because we could deliberate the rest of the day and into the weekend trying to think about what's the root cause. But the important thing is to make a change here. We can't talk about incremental changes, Mr. King. We really have to talk about fundamental pivots in the way we view things. Now, it is correct that part of the problem is our culture. I come from South Louisiana, my goodness. It is embedded in our culture to enjoy food and to enjoy rich, flavorful foods. It is in part in our environment. You think about communities like Detroit, Chicago with high density living. Those don't lend themselves, that kind of lifestyle doesn't lend itself to exercise. You think about the availability of fresh produce in African American communities, that's almost absent. And then you think about the density of fast food restaurants, you can't miss them. So the environment has an impact. Some would call it the toxic environment, some would call it the built environment, but we are a product of where we live, and our culture has something to do with it. And then you can add into economics and stress. But ultimately, the end result is this burden we have, and it's much more important, I think, to do exactly what you said, to make a fundamental pivot in the way we view ourselves and our health, and to begin now to do something positive about it.
Does heart disease and stroke present differently in African American men and women?
So this is a great question, because let's start off by saying, what's different about heart disease in general for African Americans and stroke? It turns out that African Americans, again, because of this very high incidence, end up having an earlier age and onset. So a white person might come in at the age of 65 or 70 with an episode of heart disease, chest pain, or heart attack. A black man might show up mid-40s, early 50s, 20 years younger with the same problem. This is a statement of fact. For most kinds of heart disease, African Americans show up 10 to 15 years younger with those disease processes. Now, when we talk about the differences between men and women, that becomes less an issue of race or ethnicity and more an issue of gender. And it is correct that women don't always have the same kind of symptoms, say for a heart attack. For a stroke is a stroke is a stroke. It's a brain attack, and it means some part of the brain is not working well. And so regardless of gender or race, you show up with abrupt weakness, inability to speak, loss of consciousness. That's a bad deal, and that requires prompt intervention.
Dr. Yancy, is the scope of this problem such that it should be bigger than the African American community? Should it be an issue of national concern, and why?
When you consider what this country has just been through with regards to healthcare reform, the answer is yes. For everyone, because everyone has a skin in this game. Everyone is liable, everyone is accountable, and we all have to pay for it. So we need to very quickly drop all the demographic characterizations. We need to very quickly say, you know what? The health of any one of us affects the health of all of us. And that's really an important statement. So it is technically bigger than the African American community, but you know what? It should never have been about the African American community. It should have always been about the community. And what is the health of Detroit? What is the health of Dallas, where I live now? What is the health of Chicago? That's where it should always have been. It should never have been about this niche or that niche, because we really need all boats to come up.
I understand that the AHA and the ASA have programs designed to educate and empower the African American community. Can you share with us what some of those programs are and why it's important to have them?
I'm delighted to share with you that the American Heart Association and the American Stroke Association, which is a division of the American Heart Association, have really embraced the risk, the unique risk that African Americans face with regards to stroke. We have strokes at an earlier age. The consequence of the stroke is more profound. The ability to recover from the stroke is more limited, in part because of access to rehab services. And here's another key consideration, and I hope you'll let me get this in. The African American community is not as responsive to the emergency that a stroke represents. And so we show up way too late to facilities. If you get to a facility in the right time frame, the impact of a stroke can be almost completely reversed. Hey, newsflash, this is a big deal. That is correct. What has previously been perceived to be an absolute certainty, once you've had a stroke, that's it, and you will be impaired, is not correct. If you were able to present within the critical 90-minute window, the sweet spot, if you will, we have effective therapies available in every community that can fundamentally reverse this. So we don't need to delay and consider and ponder, what should we do now that I'm feeling weak and I can't speak well? Bingo, you gotta get busy, you gotta get going. So what the American Heart Association and the American Stroke Association have done has put together this beautiful cause initiative called the Power to End Stroke. Sometimes we just abbreviate it as POWER because it is about getting all of this energy, all of this academic science, all of this clinical science behind one goal to reduce the impact of stroke in the African American community. And I got to tell you what, when you put all that science and all the organizational leverage that comes from the American Heart Association and the American Stroke Association, along with the passion that is so deeply embedded in our African American communities, power is right on. I mean, that is exactly what it becomes. But we have to continue to work to get this message out there.
And you speak very passionately about this. What is it that drives you?
You know, there are two things that drive me. Look at me, I'm African American, I'm at risk. But it's more than just being at risk. Every last one of my uncles and aunts, every single one of them has had heart disease or had a stroke. My father died of heart disease and had a stroke on the operating table. It is pervasive in my own family. I feel it, I sense it, I know it. But even beyond that, my mission as a professional from the very beginning has been encouched in this very simple phrase: how can we do the greater good? Whether it was at the bedside, taking care of a critically ill patient, in an office setting, taking care of a panel of patients, doing research, teaching, now doing administrative work, doing advocacy work, whatever the opportunity is, to do the greater good is what drives me. And there could be no greater good than helping my own community be healthier. Think about that. Talk about giving back, talking about trying to make a difference, talk about paying it forward. This is the best thing I could come up with to try to make a difference in my own community, for my own family.
At the risk of being redundant, but in this case I think it's probably acceptable, even desirable, would you state again what are the most important things that African Americans should know about this issue and being proactive and taking care of themselves?
I'm going to make it very simple. The most important thing African Americans should know about heart diseases and stroke is to embrace health. I don't want to really dress it up any more than that. Embrace health. Too many times in our communities, it is too easy to focus on the near term, what's happening today, what's happening tomorrow. The expedience of stress makes it so that you don't have to look down the road. You can dismiss what's down the road because, hey, I'm concerned about what's happening today. Payday's coming up, and can I make this work? And I'm worried about my community. Is my community safe? We have to think bigger than that. The message today, the message I want to deliver to the African American community is to embrace health. Think about preventing disease, much cheaper, much easier to deal with it before it happens than to deal with it after the fact. If you have symptoms, act promptly. Be smart about this. Don't do self-diagnosis. Get on the horn, call 911, get the right people around you. I would much rather have too many calls that are unnecessary alerts than to miss that call where you can make a difference in somebody's life. Embrace health. That's the message today.
And we, particularly black men, are often reluctant to have an ongoing relationship or pay regular visits to doctors. We've got to get beyond that.
So can we have a whole show about this? Because we really need to sit down and talk about black men. Because between obesity, physical inactivity, diet choices, weight management, our own view on what's involved in being healthy, boy, talk about a pivot. I mean, that really requires an implosion and reconstruction because we have the wrong view about what constitutes health amongst African American men.
Dr. Yancy, your message is so strong, and everything we've talked about today has been directed at the African American community and urging people to get in and take care of their health. What is the message that you would offer to those on your side of the equation, the healthcare professionals, healthcare providers, and physicians who are involved in this issue?
You know, there's an important concept, and in all candor, it too would require a more extended conversation with you, but that important concept has to deal with the phenomenon of healthcare disparity. What that means is that even when we know what to do, even when we have the resources to do it, the evidence remains that we as practitioners, self-included, as centers, local medical centers included, practice a kind of medicine that seems to preferentially treat one group differently than another group. That means to say that beyond science, we have embedded behavior traits, biases if you will, that influence the way we see disease. So in response to your question, Mr. King, the right approach is for practitioners, healthcare workers, administrators for hospital systems to think very carefully about what is the equity in the way that you deliver care to your clientele, to your patients. Are you providing the same level of care for the same kinds of illnesses consistently? That hasn't always been the case, and no one needs to be defensive about that because we all have a bias. We all have a prism through which we see information and process it. What I'm trying to do is get it so that fundamentally we all use that same clear prism when we see health and disease. How we process other things, that's fine. But when we see health and disease, let's remove the fog and have a clear prism so everyone receives the same thing. I'm not impugning any other doctors. I'm not attacking medical centers. I'm saying the data tell us that we're not doing the same thing for everyone consistently and all the time. We can be better than this. We can change the process. So you think about the power of today's message. If the community embraces health, changes lifestyles to prevent disease, and acts promptly at the onset of disease, and if the providers and the facilities treat all disease the same way, that would be the greater good. People would be better off, our health would be better, our community and our country would be better.
You're a pleasure to speak with.
So are you.
Thank you so much. I wish we had more time, and one day maybe we can make that happen. It would be nice.
That would be good. Thank you so much.
Thanks for being with us.
I appreciate it.
All right, Dr. Yancey, thank you.
Okay.
Thank you very much. Thank you for joining us.